Genomical is a digital health platform to support labs to do genomic testing. We know genomics can inform a lifetime of precision healthcare. By analysing a patient's genome together with other health and lifestyle information, doctors can better predict and prevent illness, diagnose it faster, and treat it more accurately. Genomic testing involves several key steps: getting the consent, order and sample, sequencing and bioinformatics, curating the variants that were detected to generate the clinical report, storing the data, and getting the results back to inform clinical care. At each step, data needs to be gathered and passed along the value chain. Current health IT systems aren't designed for genomics. Medical laboratories use LIMS systems for managing samples and results, but for the rest of the steps, there are gaps. Genomic datasets are just too big and complex for LIMS systems, and they don't fit in electronic medical records either. So here's what happens instead: paper consent and paper orders, ad hoc interfaces and bespoke scripts. Diagnostic labs doing genomic testing typically spend hours manually transferring data between the various tools needed for an analysis. They often keep patients' genomic data on local servers and use flash drives to move it around. Not only does this expose personal information to cyber theft, but it prevents genomic testing from ever being truly scalable. Genomic data management is holding labs back. Labs use different software tools and technologies and get data from different sources for different genomic tests. Integration with genomic software tools is complex. Procurement processes can take months, even years. And because most genomic software are cloud-based, additional security is required to use them beyond the firewalls of most health organisations. Labs are effectively limited in their use of different genomic tools. Labs are also using inconsistent data structures. Genomic data is hard to find and effectively stored in silos. It means genomic data can't easily be reused, and precision medicine remains out of reach. What's needed is a GIMS system, a genomic information management system. It fills the gaps and complements the LIMS systems. Genomical is a GIMS platform designed for managing genomic data in healthcare. It was built by an alliance of hospitals, medical laboratories, and research organisations. And it was refined over tens of thousands of real-world tests performed by 6 early adopter medical laboratories. Here's how Genomical works. It enables efficiency by orchestrating the data steps of a genomic test. Secure cloud storage allows labs to stay in control of their data. And a marketplace of genomic tools allows labs to easily use the software that they need. Genomical has a health integration engine that can support e-orders and e-reports at the point of care. It is secure by design, adhering to best practice in cybersecurity and privacy. And it has a unique data sharing capability with proper governance that enables labs to access data for clinical testing. It means genomic data can safely and appropriately be reused across the healthcare system. Genomical has a user-friendly web portal that enables labs to manage high volumes of tests efficiently. Labs can run and rerun the tests they need with the genomic software tools that they want. By selecting the test type from the menu, Genomical's proprietary genomic orchestration service automates the movement of data in and out of the different tools required for that test. They stay in control of their data and can easily find and access their genomic files when they need to. All activity in the platform is underpinned by a comprehensive audit capability. Genomical enables safe data sharing. To reuse existing patient genomic data, labs can make a request to access data from another diagnostic lab. They can do this if the patient has consented to it and if the reanalysis is for the purpose of clinical care. It means there aren't multiple copies of people's genomic data. Instead, access is controlled and reuse is safe. This means laboratories get efficiency through automation, a marketplace of tools, secure data storage, and safe data sharing. It also means clinicians can get genomic orders and reports at the point of care, and patients can get answers when they need them. For more information, head to genomical.com.au.